Welcome to the ESI Emergency Safety Interventions Training. This training is for all USD 458 and 464 staff. The information is provided to you by Donna Foy, Robin Sharp, and Bo Youngblood. This all-staff training objectives are as follows: to define emergency safety interventions, to identify the requirements of the ESI regulations, and discuss basic prevention and de-escalation strategies. We'll also discuss if an ESI has occurred, and to determine next steps to promote an environment and culture of prevention. The history is as follows. In July of 2009, Secretary of Education Aaron Duncan sent a letter to Chief State School officers, stated that he was deeply troubled about the current use and effect of restraint and seclusion, which were the subject of testimony before the Education and Labor Committee in the U.S. House of Representatives. Recent hearings had examined the abusive and potentially deadly application of restraints and seclusion techniques in schools. The regulation of the use of ESI with all students went into effect in Kansas on April 19, 2013. The regulations do require training. All school personnel are required to be trained, including administrative assistants, office personnel, bus drivers, lunchroom staff, custodians, etc. The regulations do not require that every staff member be trained in the most restrictive behavior intervention techniques, i.e. the use of restraint. Schools are encouraged to review their data on the use of seclusion and restraint, review the duties of staff members, review the training that is already in place in the district and in school, and determine training needs based on this information. What is ESI? A response to an emergency situation by use of restraint or seclusion, a way to keep people safe. Use of ESI for any other purpose is prohibited. Must be discontinued as soon as immediate danger to self and others has passed. Not ever used for the following: for discipline, for punishment, to gain compliance, as part of a behavior plan, not an acceptable alternative to prevention. ESI is defined as emergency safety intervention. The emergency is immediate danger. The safety, student harming self or others. And intervention, restraint or seclusion, should only be used for limited periods of time and should cease immediately when the immediate danger of harm to self or others has dissipated. What is restraint? There are three different types of restraint. First being mechanical restraint. This is prohibited. The use of any device or equipment to restrict a student's freedom of movement. This term does not include devices implemented by trained school personnel or utilized by a student that has been prescribed by an appropriate medical or related service professional, and are used for the specific and approved purpose for which such devices were designed, such as adaptive devices for mechanical support used to achieve proper body position, balance, or alignment. Vehicle safety restraints, when used as intended during the transport of a student in a moving vehicle. Orthopedically prescribed devices that permit a student to participate in activities without risk of harm. Second is chemical restraint. This also is prohibited. Administration of a drug or medication to manage a student's behavior that is not standard treatment and dosage for the student's medical condition. Third is physical restraint, allowable under certain circumstances by mandate-trained personnel. A personal restriction that immobilizes or reduces the ability of a student to move his or her torso, arms, legs, or head freely. The term physical restraint does not include a physical escort. It is acceptable for mandate-trained personnel to physically restrain students in the event of an emergency. It is unacceptable for any other individual to engage in the restraint of a student. Physical restraint. Physical restraint shall only be used in an emergency situation when the student presents an immediate danger to self or others by mandate-trained personnel for as long as necessary to resolve the actual risk of danger or harm that warranted in the use of physical restraint. Mandated guidelines have a maximum time limit of 3 minutes. Be no greater than the degree of force necessary to protect the student or other persons from immediate physical harm. Be used in the presence of at least one additional adult who is in line of sight, unless no other adult is immediately available due to unforeseeable emergency situations. Physical restraint shall not be used as a form of punishment, be used for convenience of district personnel, be used to gain student compliance, place pressure or weight on students' chest, lungs, sternum, diaphragm, back, neck, or throat that restricts breathing. Prohibited restraints are face down, physical restraint, face up, physical restraint that obscures or obstructs airway, physical restraint that impacts students' primary mode of communication, restraining hands of students who sign, gagging a student, covering student's mouth with tape. What is seclusion? Seclusion is the involuntary confinement of a student alone in a room or area from which the student is prevented from leaving. Timeout is not seclusion. Timeout is a behavior management technique that is part of an approved program, involves the monitored separation of the student in a non-locked setting, and is implemented by the purpose of calming. In-school suspension is not seclusion. ISS is disciplinary placement of a student in a location away from the general classroom, yet the student is not secluded from others, nor prohibited from leaving the room, nor it is a response to an emergency situation in which the student is a danger to self or others. In-school suspension is not seclusion. ISS is disciplinary placement of students in a location away from the general classroom, yet the student is not secluded from others, nor prohibited from leaving the room, nor is it a response to an emergency situation in which the student is a danger to self or others. Seclusion shall only be used in an emergency situation when less restrictive measures have not effectively de-escalated the situation by trained personnel, and seclusion shall never be used as a form of punishment for the convenience of district personnel to gain student compliance. Monitoring. Students must be monitored by district personnel who are in close proximity and able to see and hear the student at all times. Students must be monitored by district personnel who are in close proximity and able to see and hear the student at all times. Monitoring shall be face-to-face unless personal safety is significantly compromised, in which case technology-supported monitoring may be utilized. Seclusion should cease when the emergency situation has passed. Total time in seclusion is to be reasonably calculated based on the age of the student and the circumstances, and is not to exceed 40 minutes without a reassessment of the situation and consultation with administrative staff, and when possible, parent or guardian, unless otherwise stated in a parentally agreed upon written plan IEP 504 intervention plan to address students' behavior. Seclusion can occur in any location. However, if there is a room dedicated to seclusion, certain standards apply. Size should be appropriate to students' chronological and developmental age, size, and behavior. Ceiling heights should be comparable to the ceiling heights of other rooms in the building. Rooms should be equipped with heating, cooling, ventilation, lighting systems, and are comparable to that of the other rooms in the building. Rooms should be free of any objects that pose a danger to the student who is being placed in the room. Rooms should be equipped with a door that locks only if the lock is equipped with a device that automatically disengages the lock in case of an emergency such as a fire or tornado. Scenarios. Consider these questions for each scenario. Is it an appropriate reaction to the situation? Should it be reported as seclusion or restraint? Scenario 1. A student was brought to the office suspected of being in the possession of drugs. The resource officer and the principal questioned the student. The student jumped up and began to make a run for the office door, but the principal grabbed the student and detained him. Is this an appropriate action? Should it be reported? Scenario 2. Chris sometimes becomes aggressive towards staff, hitting and kicking them. When this happens, Chris is removed to a designated room until calm. The adult supervising Chris stands at the threshold of the room. There is no door, and Chris cannot leave until he has been calm for at least 60 seconds. Appropriate reaction, or should it be reported? Scenario 3. Pat has a history of violent outbursts in the classroom. Recently, during a tantrum, Pat began throwing objects around the room while yelling obscenities. The rest of the students were removed from the room. Pat was kept in the classroom until calm and back under instructional control. During this time, the teacher stood outside the classroom door, observing to be sure that Pat did not cause harm to self. Is this an appropriate reaction, or should it be reported? Scenario 4. Kinder is a kindergarten student who frequently runs about the classroom, hides under desks, and may scatter objects around the room. This is very disruptive into the classroom. The teacher calls the principal for assistance. The principal picks up the student, carries her to the office. The student is resisting and struggles to get away as she is being carried to the office. Is this appropriate reaction, or should it be reported? Scenario 5. Sam is frequently frustrated and has a temper. Twice earlier this year, Sam became severely agitated and threw things at other students during individual work time. Now, when Sam began to show signs of serious agitation, the teacher prompts Sam to go to the corner for a break. Sam uses a board game timer to monitor the time and is supposed to go back, sit down, and resume work after a 5-minute break. Sam had 3 timeouts last week. Is this appropriate reaction, or should it be reported? The new rules are, there's a 4-key standard. It's communication, documentation, training, and appropriateness of intervention. What needs to be in place to comply? Prohibition to certain types of restraint: chemical, mechanical, specific or physical holds. Parental notification within 2 school days of use of ESI. KSDE recommends by the end of the school day in which ESI was used. Documentation of the used ESI. Date, time, type of intervention, length of time the intervention was used in minutes, name of school personnel who participated in or supervised the intervention, date and time parents were notified and by whom, on district reporting forms. Reporting to KSDE by building administrator continues. Training of all staff, bus drivers, custodians, secretaries, cafeteria workers, all teaching staff, and parents. Written policy adopted by the local Board of Education, the BOE, that applies to all students. Parental notification of policy annually. KSDE recommends posting on district website, written in school safety plan, and make it part of the student handbook. Procedure in place for periodic review of the new ESI in the district. Documentation of ESI must be compiled and submitted at least biannually to the superintendent or designee. Policy must include a local dispute resolution process to include the following: complaint investigation procedure, procedure for parents to present written complaints to the local board to initiate complaint investigation by local board, procedure for parents, school, and KSDE to receive written findings of fact and, if necessary, corrective action from local BOE within 30 days of filing the complaint. The SPD parent can also go to IDEA, dispute resolution processes. Any student can also go to OCR, dispute resolution process, if applicable. How to tell if a student is going to lose control. Their face may redden, the voice may rise, they may breathe faster, they may make prolonged eye contact with you, they may make exaggerated gestures, they may appear very tense, They may begin to pace. They may clench their fists. They may clench their jaw and tighten facial muscles. They may engage in other behaviors that are unique to them. What to do if a student is out of control? The de-escalation techniques continued. You gently announce action before initiating them. Give them space so they do not feel trapped. Gently announce actions before initiating them. Give them space so they do not feel trapped. Keep both hands relaxed and visible. Discourage an audience. Give clear, brief instructions. Provide choices. And be patient. Avoid the following. Taking the bait. It's not about you. Touching the student. Overreacting. Continuous eye contact. Arguing or trying to reason. Engaged in power struggles. Telling the person you know how he or she feels. Raising your voice. Giving ultimatums. Aggressive language, including body language. How we can reduce the need for restraint and seclusion? Positive behavior interventions and supports. This is PBIS. What is PBIS? PBIS is a new way of thinking about behavior based in research. It is not that the student is bad. We just have some behavior that needs to be changed. Behavior is communication. Behavior is serving a function to get something or get out of something. To get something, attention, access to materials, sensory stimulation. To get out something, escape a task or event or sensory escape, pain. What helps students change behavior? By altering or adapting environments, teaching routines, expectations, and skills, and appreciating positive behavior. Altering or adapting your environments. Your physical environment, remove or modify environmental conditions that may trigger challenging behaviors. Your room arrangement, your seating, traffic patterns, noise, is it too hot or too cold? Educational environment, increase predictability, increase choice making, make curricular adaptation or modifications. Teaching routines, expectations, and skills. Teaching appropriate behavior is like teaching any other skill. State the skill. State when and where it is used. Model it. Practice, 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 and more practice. Practice it in context. Use the direct instruction method of I do it, we do it, you do it. Reinforce when it is correct. Appreciating positive behavior. Reward the behavior you want to see in every time you see it. Be consistent. Types of rewards of positive consequences. Free and frequent. Intermittent. And long and strong. Free and frequent. Thumbs up. A smile. Smile and a nod. Stickers or stamps. Verbal praise. Notes home. The intermittent. Phone calls. Special privileges, extra computer time, special seat, note to the principal, high fives. Long and strong. Field trips, special projects, student of the week, good behavior honor roll. What about negative consequences? Remember that behavior is strengthened or weakened by its consequences, both positive and negative. Adults often, unknowingly, reinforce the very behavior that they want to change. Negative consequences used to decrease problem behavior. Functional, applied in an educative rather than punitive manner. Presented in a hierarchy from lesser to greater intensity. Best applied in combination with positive consequences or rewards. Very important to ensure that they are logical, natural, and preserve a student's dignity. Other negative consequences are verbal reprimands, planned ignoring, redirection, corrective teaching procedure, phone call home, timeout from positive reinforcement, a timeout with think sheets, after school or lunch detention, or office referral. Negative consequences. When delivering negative consequences, remember to apply consistently, use the power of proximity, make direct eye contact, use a soft voice, be firm and anger-free, link the consequence to the expected behavior, never accept excuses, bargaining, or whining, be educative, not punitive. Relationship building. The best way to change unwanted behavior is to build a strong, positive relationship with the student. Positive communication. It is not what you say, it's how you say it, your tone, the volume. Really listen to show concern. Genuine, caring attitude. Get to know them as a person. Show interest in their interests. Show respect to get respect. Thanks to the following individuals and organizations for the use of their resources in developing this presentation: the KSDE, Diana Browning Wright, Randy Sprickett, Safe and Civil Schools, and Dr. Laura Riffle, the Behavior Doctor, and Mandan.